we're talking about degeneration and arthritis in the spine. A lot of people think about arthritis and they think it's maybe a symptom of getting old. Or maybe they have a relative that has something like rheumatoid arthritis, or they've told you they have osteoarthritis, or their joints are wearing out. I used to think that arthritis was like a swelling of a joint, but I never really thought, well, what causes that swelling? So as I went through chiropractic college and studied it more, what we found out is when the spine goes out of alignment, it changes the forces on the spine. And when the forces on the spine change, it changes the way the discs and the vertebrae work. On this chart right here, it shows us a normal curvature of the spine. Okay, that's the neck area. And then if the neck goes out of place, the curvature changes, it flattens. Then over years, the discs in there start to get compressed and we see the bones, the discs starting to narrow, and then the bones start to become affected because the discs get smaller, the bones get squished, and their shape changes till eventually the bones can get squished right together and the bones can totally change their shape. Now this isn't good because what happens is the vertebrae don't work properly. They won't move and bend and twist properly, so you're going to get stiff and tight. A lot of times my patients say that when the weather changes, it really affects their joints when they have arthritis. But even more important, inside the spine, there's a spinal cord. And if that spinal cord starts to get pinched or compressed, because the spine's wearing out and there's less room for the spinal cord, then the nerve flow can be affected. And then the power won't get through from the brain down the spinal cord into the organs. This can cause other health problems, not just pain, but it can weaken the body, can weaken the organs, and it can just weaken the way your body functions. So it's really important that we stop the degenerative process, the arthritic process, correct it as much as possible. Then we want to maintain that nerve flow so lifelong you're able to do the things you love to do. Thanks for joining me today, and then tomorrow, stay tuned for our next installment of the Health Minute.